Also from the sector, a medical breakthrough is available locally for many males who suffer from the side effects of diabetes. Antoinette Smith joins us live in studio with the latest. Good morning, Antoinette.
Thank you, LaDon. Well, according to the World Health Organization, 150 million men worldwide suffer from erectile dysfunction. That's more than 18 million men in the United States. And according to our next guest, at least 35,000 men right here in the Bahamas suffer from the same condition. So joining us live in studio is urologist Dr. Gregory Pinto, who's going to tell us about the newest innovation in dealing with this issue. Welcome to the Morning Edition.
Good morning, Bahamas. Thank you for having me.
That is quite a large number of Bahamian
And
males.
that is probably a conservative estimate, so the numbers are probably a lot higher than that. So every man at some point in their life is going to have to face erectile dysfunction. We have a very high incidence of diabetes, hypertension, hypercholesterolemia, sickle cell. All of those can lead individually or collectively to erectile dysfunction. There are several lines of treatment, but here I'm here to announce that we're rolling out the last resort. So this is the Bionic penis. This is a self-concealed, basically penile implant. I know this is the Christmas season, but in the spirit of Easter, I want to tell Bahamian men that they can always rise again. Not only rise again, but rise again better, stronger, and longer than they've ever risen before. So there's no need for so many Bahamian men to live in silence with profound erectile dysfunction, never getting any erection again. They live their life basically as a social piranha. They've ruined their relationship, poor self-esteem. This is a minimally invasive procedure where we can put a self-contained advanced 3-system device with a reservoir of fluid, 2 chambers in the shaft of the penis itself, with an activating and deactivating device within the scrotum. Essentially, you can feel this button in your scrotum yourself. You can press it, and you can be up for as long as you want. You have the same sensation. You can ejaculate, have the same orgasm. You can have children. This is for all age groups. So this is the last resort. We got sickle cell disease affecting young men, might be 20 years old. They'll never get an erection again. As well as we can go to men in their 90s because of hypertension, atherosclerosis, never getting an erection again. So you can always rise again. We're also rolling this out as medical tourism, not only for the local market of the Caribbean, but North America, South America, Europe, predominantly France, Germany, and United Kingdom. So this is a major innovation that has been around since 1973, but this is the latest and most advanced version of it. So your partner cannot even feel that you have the device. You cannot see that you've had the device. The device can be placed minimally invasively in 20 to 60 minutes. You can go home. It can be done as an outpatient procedure with minimal recovery, and you can be back in the saddle again better than you ever were in the past.
As you've said before, this device has been around for quite a while.
Yes, but it's gone through many versions. This is the most advanced version of it.
So it's sort of new to us here in the Bahamas.
Yes, it's not science. It's not science fiction. It's a reality. You, as a man, there are thousands of Bahamian men who have no erection or very poor erections. Obviously, this is the last resort. We'll go through several lines of treatment. If no other line of treatment has worked, and the first line of treatment is treating the cause. Erectile dysfunction has a cause. If it's uncontrolled diabetes or poorly controlled diabetes or hypertension, it can be the result of prostate cancer curative treatment, whether it's radiation or surgery or colorectal surgery as well. So there's a long list of causes of erectile dysfunction, but we must treat the root cause. We say that erectile dysfunction is the window of the heart. So you can pick up heart disease, atherosclerosis, many years before it affects your heart or your brain by it presenting with erectile dysfunction, because the clogging of the arteries will affect the smaller vessels, which involve the vessels supplying the penis, way before the large coronary arteries that supply the heart or the blood vessels that supply the brain. So this can prevent you from getting a stroke 20 years down the road or getting a heart attack 20 years down the road by getting your erectile dysfunction worked up and making sure that we treat the root cause so it doesn't get worse and we can treat the other causes effectively.
Yeah, this is a topic that many people don't like to discuss publicly.
Yes.
So have a lot of Bahamian men met this with resistance, or are they quite positive about this and have shared interest in this new innovation?
Unfortunately, many men will suffer in silence 5, 10 years, and it's usually their partner. So the erectile dysfunction, couples go through it. It's not just the man. But my take-home message is that you don't have to give up. You can always rise again. No one needs to know. So this whole innovation, we're presenting anonymously. So we use fake names. No one needs to know your business. It's a quick, minimally invasive procedure. You come in, you go, and your life is changed positively forever. And then the cornerstone of my practice is confidentiality. So I've heard it all. I've seen it all. Nothing is going to change the expression on my face. Compassion, comprehensive care, we can get you back to where you once were. You're not, in fact, better than you ever were before.
Well, so when can we expect the
So
first procedure to be done?
This rollout is throughout December, and it's going to be the routine, hopefully, in this country every week or every other week, not just for foreigners, but for local Bahamians as well. So within 10 days, we're going to do the first set of procedures.
What's the numbers like of people on the market just looking to?
I have right now a waiting list of almost 60 local patients and almost 80 foreigners. So it's an overwhelming first rollout. So this is just going to continue.
When can we? Is there an expected date? Will medical studies be published about this?
It's widely. So this has been going on for 40 years. So this is a proven device. Boston Scientific has the most advanced, innovative device right now. So you can Google it and you'll have 80,000 articles on bionic penis or erectile dysfunction related with penile prosthesis. So this is not science fiction. This is something that is scientifically proven. Over 500,000 men worldwide have had a bionic penis implant.
So this is something that Bahamians, men in general, all over the world, should not be timid about.
It should not be timid. It should not be something that they should be afraid because it's minimally invasive. No one's going to know that you have it. Your partner cannot feel that you've had it. No one can look at you and see that you've had it. Only you would know that you have the device. And as I said, you can rise to the occasion whenever you want for as long as you want. So you can be 80 years old and you can have an erection, a full erection for as long as you want. This device also is the only device in the market that I'm using that can actually increase your length by 25%. So it can make you longer, stronger, and better than ever before. Bionic penis.
Oh, thank you, Dr.
Thank you very much for
sharing that insight. If you want to read more about it, of course, you can check that study out in the Boston Medical Journal, as he said. That's all for now.